Welcome everyone. Again, my name is Nicole Yo-Fisher. I'm one of the clinical educators at HealthInfoNet. And I will be helping today along with Scott Parody, our project and QA coordinator here at HealthInfoNet, to do today's webinar on the clinical portal, help desk, and auditor user role functionality. This is part of our monthly webinar series. So let's go ahead and get started. So today's webinar presenter is Scott Parody, our project and quality assurance coordinator. Scott's information here on this slide, and we will make sure that folks get a copy of today's PowerPoint presentation as well. But we also do have additional educational opportunities, so always please feel free to contact our clinical education email address, which is listed here. Obviously, myself and Sharon Bearer, our other clinical educator, we do lots of different types of clinical education. Obviously, because of COVID, not so many in-person trainings right now, but we do offer webinar training, so please feel free to reach out to us. We also have an online training platform, which is our HIN Academy, which you can get CNE credit for, so please feel free to visit the website for more information as well. Today's webinar objectives are to educate on connections and services of HealthInfoNet, and as we are the Maine HIE, or Health Information Exchange, we want you to be able to understand how to effectively leverage our clinical portal's help desk and auditor user roles, including when, how, and in what circumstance the roles are critical in participating with the tool. And also to provide information around our education and training opportunities. So just a little brief overview of HealthInfoNet, what we are here as Maine's Health Information Exchange, and talk a little bit more on a high level around our education or connections and services. So what is HealthInfoNet? We are the Maine's Health Information Exchange. We do have state law that governs what we do here at HealthInfoNet using our clinical portal. We have patient-informed consent requirements that are part of those organizations that participate with us. We are an independent nonprofit organization, so we do have a governed voluntary community-based board of directors and advisory committees. Our members in those committees and with those board of directors, the members represent medical providers, public health organizations, patients, government agencies, and businesses throughout the state. So within here at HealthInfoNet, we have services that we provide to our participating provider communities, which include access to the clinical portal. We also, within the clinical portal, have our real-time event notification tool. We do public health reporting, and we also do have a predictive analytics tool. Our vision at HealthInfoNet is to deliver trusted health information exchange services to help communities create a lasting statewide improvements in the quality and value of patient care they provide. We want to create better, easier, and safer solutions. And through the application of timely and actionable information, we adapt and advance in clinical workflows and operational needs which change across the care continuum. So a little bit, just a high-level overview of our HIE participants. So we have about 790 plus connections throughout the state. We are connected to all of the major healthcare systems in the state, which include all of the hospitals throughout the state of Maine, including the large tertiary hospitals, the acute care hospitals, and critical access hospitals. We do have a VA connection. It is currently down. As you'll see, that is one of the notes that we have on the login screen of the clinical portal. We are hoping to get that connection up and going soon. We are still working out some things with the VA as they have transitioned to a new EMR system, so more to come on that. We also have a large majority of FQHCs along with some ambulatory facilities. We have behavioral health information in the clinical portal along with some post-acute care facility connections, laboratory data. We have pharmacy data through SureScripts and Maine Care. And then a new addition to the clinical portal is Maine EMS data. This is a brief snapshot of some of the data sources that we have within the clinical portal. So obviously demographics, encounters, vitals, immunizations, allergies, diagnosis information, along with lots of different types of documents, as well as some social determinants data, which we hope to continue to gather more of that data and be able to put it in the clinical portal. So I'm going to go ahead and hand over the reins to Scott.
Thank you, Nicole. That was a wonderful introduction. Just wanted to quickly introduce myself. My name is Scott Parody. I am the project and QA coordinator for HealthInfoNet. I've been with HealthInfoNet for about 5 years, starting off in their customer care division and recently transitioned into this role. And in particular, this webinar today is going to cover the functions of the help desk and auditor user. And the help desk, so in particular, the help desk user role is what we provide for user management for your organization. There's a level, there are various levels of functions that we can use or that we provide for you to manage and create or request new user roles. The actual user guide can be found at the link below, the hinfonet.org/resources/training-materials. Next slide, please. So we oftentimes get this question, but who should be getting a help desk user account at your role? This is primarily for your own internal IT or IS help desk users. If you have anyone that you would define as a super user, maybe somebody who plays multiple, or wears multiple hats in your organization or your office, practice managers, team leaders, and other designated leadership. Next slide, please. So with the help desk, you can actually do a number of functions in terms of user management. You can reset a user's passwords. You can enable or disable an account. If a user has a name change, you can update that name, email address, or even their description if they've changed roles within your organizations. You can set login limitations. You can change the home. You can change their landing page when they log in. And for certain users, we actually have an online form for how to request new users. However, this is specific to users who connect to our VPN. So you have to be connected to our VPN and you have to be assigned to the new users request group within our clinical portal. Next slide, please. So I'll actually be giving a demonstration right here. So you can search for a user by their first name and last name. So for instance, you can search that way. If you happen to know what their user ID is, you can search by that and get directly to their user or anyone that has a matching one. If you want to search for all clinical access users in your organization, so this would be any user who's in the clinical or clinical admin role, you can search by associated facility. And return a list that way. If you're trying to get all users within your organization, because the associated facility only returns users with clinical access, you can also do an email search. And what I usually recommend is that you just search for your domain, and then you can pull up users that way as well. We do have people who, we do have the ability to search by group membership. It's not, we find that not a lot of help desk users particularly use that function, but it is there. For instance, if you wanted to know if who was part of the clinicians group, you can do that as well. Please note that when you're searching, you're actually searching everyone within the clinical exchange. So it's always good to narrow down your searches as much as you can. So to access a user, you would search. You would find a user from the search screen, and then we can just click anywhere on this row and open them up. So from here, you can see the user's name. You can see their current inactivity logout. You can modify this for the next session. You set it anywhere from a 2-minute warning to a 1-hour warning, but the default for all users is 1 hour. So if a user hasn't used the clinical portal in an hour, they will be automatically logged out, but they do get a warning. If a user has had a last name change, you can change it to a new last name. And just click Update Preferences. Update Preferences is what will save your changes. Again, also here, if you need to update their email address or update their credential, for instance, if they've gone from a CNA to a nurse, which is a very common progression that we see, we can change it that way. Also, the user description box is going to be what you see when the user is searched on the search screen. One of the most common functions that the two most common functions that we get actually are password resets. So if you wanted to reset a user's password, you can just click on Reset Password, and you can create your own special passwords. For instance, a lot of places use welcome123, and it's a standard verification process. You can just click OK, and that user's password is now reset. It does not automatically send an email to the user. You will have to notify the user that the password has been reset. You also have the option of just generating a random strong password for the system to use if you wanted to do that as well. But it supports either your own password processes or a random strong password. You can change the user's landing page when they log in. However, the user can do this themselves. So unless they made a change that they're unable to correct for that, you can come in here and make that change as needed. The other primary function that we see a lot of users request is the ability to activate and deactivate accounts. So if you were to come in here, you can label this account disabled, click OK, and access to this account is no longer active. So if a user attempts to log in, they'll be prompted to contact you to reactivate the account. If your user has gone inactive because either the account has been administratively disabled or the account has been deactivated after 180 days with no login activity, you can just come back to the Configure button, click on account, remove the check mark from account disabled, and click OK. And now that user will have access to the exchange again. Some other functions that are not typically highly utilized, but we like to highlight. If you have a user that you just want to limit access to from a particular standpoint or for a particular date range, you can put in the start date and end date, and the user will not have access to that. You can also limit user logon. So if you had a user that you just had that you were just giving very limited access to for a very specific amount of time, you can actually set that if you wanted to. We find that a lot of organizations don't utilize that very highly, but it is a important function. For users that belong in the new user request group, this is who we call an authorized account requester. You'll have this option under links to launch the new user request form. You would just fill that out with your new user's information, including first name, last name, the user ID that you would like to use. Please note that all user IDs in HealthInfoNet are unique. So for instance, someone who's J. Smith at one hospital can't use that, can't have the same one at another hospital. The user's email, the different account types that you can request. There's clinical and clinician administrative. These are just two different variations of the same account. One is to highlight for clinical staff. One is to highlight for administrative and support staff. Clerical, which just creates access to accounts for demographic reasons. The auditor account, the help desk account, and the I support, which is often used by data quality people. You notice as you highlight over, or sorry, you mouse over each account type, it'll give you the preferred user type for that account. You would just fill this out, click continue, put in the, on the following page, you would enter in the email addresses you want the welcome email to go to, and that will go into our approval queue, and then we approve those usually within the same business day. So, all right, thank you very much. Just like the help desk user account, the auditor role is a self-service account for those users who need to work in either compliance or privacy work. And the audit portal allows you to, the function of the audit portal is to allow you to see what your users are accessing and how deep into a record they're getting. Again, you can find the actual user guide at the link below. Next slide, please. So again, we often ask who should be getting an auditor account. So anyone who works as a privacy or compliance officer, practice managers, team leaders, and designated leadership. Basically, anyone who you would have to report on your users' activity and access for HIPAA compliance. Next, what sort of activity can be audited in the audit portal? Well, you have individual user activity. You can audit all users for your facility. You can look at access across time, and you can actually even access, or you can even audit for a specific MRN, medical record number, to see who's accessed that record. Next slide, please. So the sort of information that you can get from the auditor role are some specific what we call events within the exchange. You can see their access reason, which is the reason that they select when they unlock the account or break the glass, as we previously called it. You can look at what documents they've viewed, if they're looking at maybe documents that are not within the scope of their role. You can look at information about what labs they're looking at, and any specific applications. For instance, the VA search, as Nicole said, if they open up the VA search on a patient, that information is visible. And also if they're adding my patient, if they're adding that patient to their clinical, to their notifications panel, that will also be available. It's important to note that you're not actually looking at the documents themselves, only the record that they've accessed the document. There are also several internal processes that will appear in the audit that just basically demonstrate or indicate that certain information has been loaded. And when we get into the example, we will, I'll give some more detail on that. Next slide, please. All right, well, I'll begin sharing my screen again. So this is the audit portal as it currently exists. Again, you have the username field, you have the user associated facility dropdown, and the patient ID. So to demonstrate, we're going to do an audit on a particular user. And when you're auditing, you can audit for a particular date range. This helps limit the number of results. It also helps increase the speed of the results. By default, the date range is always 3 months. However, I usually recommend setting the date range as narrow as possible, just to help speed up the results. For results where it says all success and fail, I strongly recommend that you don't actually populate these because it can kind of throw off the results. But just leaving them blank will get you the information. So once we have populated the user ID and the date range, you just click on search, and these are your results for the auditing. So we can see that this particular user went into these patients. These are test patients. This isn't live information. But we can see that Nicole, who is a user role clinician for HealthInfoNet, went into CPSI Test Goofy on April 10th at 12:09, and the reason that she gave was for direct patient and ambulatory care. So this right here can tell us if who Nicole has accessed, and gives you a simple, straightforward first name and last name in case they're going to be accessing someone who is not within their scope of their job. If we wanted to get a more detailed level about what she looked at when she opened up Mr. Goofy here, we can just click on that row of this user for this particular date in this patient. You can see that we see the privacy override feature, or the privacy override event, which is the reason they used to break the glass. If they put in a note for something along the lines, like they were opening up for lab results, something like that, you can see that here. Context change is just an internal process that starts the patient to load the screen. These, the Orion, the dynamic patient summary, the search and demographics, the problems, the allergies, and the encounters and medications, these are all the internal processes that run to load the patient information. And if we had a document here, you would see event type would be document. If you wanted to look at access for all your users across across your facility, again, you would just populate a specific time frame. Again, I recommend as narrow as possible, because larger searches can actually cause the query process to time out. Find your facility, and just click on search. And again, you can, from this level, you can actually see all users that are associated with your facility and what their access history is for that particular date. And if I can scroll down to here to the bottom, as you can see, you can actually export these results. You can export this if you need to use it for reporting or other documentation purposes. There we go. Can you see that, Nicole?
Yep.
Okay. So this is the CSV export. So again, if you needed to keep a record or any other kind of documentation, you can export this to a CSV format. All right, Nicole, and we're back at the audit user search. Is that correct?
Correct.
All righty. So the final search that we're going to do is the medical record number search. So if you're sharing data with HealthInfoNet and you wanted to see who has accessed a particular medical record, you can look at it here and then do a search. Now this is somewhat limited in the information it's going to bring back to you. One thing is that this does not define what facility it comes from. We see a lot of users attempt to define it with the user facility search, but that's not the case. This is the specific raw value. The other issue is that if you are an organization that uses an EMR that another organization uses, and they use the same medical record pattern, it's possible that you'll see access for patients that you're not intending to audit. If you're concerned about access for a particular patient and you want something a bit more deeper, HealthInfoNet customer care can actually provide that. Also, if a patient is asking who has accessed their record, that's something that HealthInfoNet can provide pretty efficiently and in a bit more detail than what could be easily accessed here. So we ask that you refer users to us in that situation. All right. So again, we've covered, for the help desk, we've covered how to search and how to access and reset and enable and disable a user. And we've also covered how to audit your users. So those are the two primary two primary account support types outside of the clinical use that can both help manage your account use. They can both help manage your users in terms of their access and in terms of their activity within the clinical portal. And with that, I thank you. I will turn it over to Nicole to wrap us up.
Great. Thank you, Scott. That was excellent. Thank you. So just to sort of wrap things up, we do have a couple of slides here. Once again, just providing you all with our information in regards to clinical education. So please always feel free to reach out to myself or to Sharon Bearer. We also have our individual emails, but we do have our client education general email too as well. So please always feel free. As I said, we can easily hop on and do brief, quick question webinars. We can do full-length clinical portal training webinars. We have recorded today's webinar in regards to those help desk and auditor user functionality. So this will be posted up on our website as well. So if folks weren't able to attend today, but they're interested in watching it, it will be available there as well. We have lots of different resources on our website too, including those user guides that you saw Scott reference there. So those are always available for folks. And just to reiterate, we also do have our HIN Academy, which is the web-based online tutorial program that we have where you can get CNE credits for going through that, that training. So please feel free to search those out. And if you do have any questions, please let us know. I'll go ahead and leave the chat open. People can certainly unmute themselves if you have questions, but we will just hang out here for a few minutes and answer any questions that folks might have. So please feel free to either put it in the chat or to unmute yourself and go ahead and ask.